Welcome to Review Central. This is NCLEX Reviewer number 13, featuring questions on pharmacological and parenteral therapies. This reviewer is intended for those who are eyeing, or are set to take, either the NCLEX-PN or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous NCLEX exams. Let's begin. Question number 1. Which of the following is not a direct-acting cholinergic agent? A. Bethanechol. B. Carbachol. C. Pilocarpine. D. Neostigmine. The correct answer is D. Neostigmine is not a direct-acting cholinergic agent. Neostigmine inhibits cholinesterase, preventing the breakdown of acetylcholine. In this way, it stimulates the parasympathetic nervous system. The other options are direct-acting cholinergic agents. Neostigmine increases the concentration of acetylcholine in the synapse, causing constriction of the pupils, increased intestinal activity, and increased secretion by the sweat and salivary glands. Neostigmine is used to treat myasthenia gravis. It also causes decreased eye pressure, so it is used to treat glaucoma. Atropine or glycopyrrolate is sometimes given with neostigmine to prevent side effects. Neostigmine is a quaternary amine that is poorly lipid-soluble. It has a short duration of action. Question number 2. A 50-year-old man with hypertension presents with his third attack of gout in 3 months. The patient is started on colchicine, but what else should be done? A. Start probenecid. B. Start allopurinol. C. Stop hydrochlorothiazide. D. Start oral steroids. The correct answer is C. Stop hydrochlorothiazide. Hydrochlorothiazide and many other diuretics elevate uric acid. Allopurinol, febuxostat, and probenecid are contraindicated during an acute attack. They are for use after the acute attack to prevent recurrent attacks. Intra-articular steroids can be used but are very painful when used on the first MP joint. Question number 3. Permanent tinnitus is most likely to occur in patients treated with which of the following drugs? A. NSAIDs. B. furosemide. C. cisplatin. D. neomycin. The correct answer is C. cisplatin. Permanent hearing loss may accompany tinnitus in patients treated with ototoxic chemotherapeutic drugs. Tinnitus is the term for hearing sounds that come from inside your body, rather than from an outside source. It's often described as ringing in the ears, although several sounds can be heard, including buzzing, humming, and grinding. Cisplatin drugs are most commonly associated with permanent tinnitus. Question number 4. Which antiasthmatic drug inhibits the leukotriene receptor? A. Zafirlocast. B. Salbutamol. C. Ipratropium. D. Prednisone. The correct answer is A. Zafirlocast. Zafirlocast and montelukast are leukotriene receptor antagonists that are taken orally. They are indicated for asthma and are used off-label for allergic rhinitis. Leukotrienes are cytokines manufactured from arachidonic acid. Leukotrienes can cause inflammation in asthma and allergic rhinitis. Zafirlocast blocks eukotriene size LT1 receptor types. Zafirlocast is effective in preventing antigen-induced and exercise-induced asthmatic attacks. Question number 5. Which of the following does not result from administration of hyoscyamine? A. Decreases cardiac output. B. Dry secretions. C. Blocks histamine receptors. D. Causes mydriasis. The correct answer is A. Administration of hyoscyamine does not decrease cardiac output. Hyoscyamine blocks the action of acetylcholine and parasympathetic sites in smooth muscle, secretory glands, and the CNS. Being an anticholinergic medication, it increases, not decreases, cardiac output and dry secretions. It also antagonizes histamine. It is similar in action with atropine. Clinically, it is used for gastrointestinal disorders including irritable bowel syndrome and peptic ulcer disease. Question number 6. A patient is most likely to develop a vaginal yeast infection after taking which one of the following drugs? A. Ibuprofen. B. Estrogen. C. Progesterone. D. Ciprofloxacin. The correct answer is D. Ciprofloxacin. Ciprofloxacin is an antibiotic. Bacteria die with antibiotics, which result in increased nutrients, and nature fills the void. Antibiotics allow an increased growth rate of yeast and viruses, due to the death of bacteria. Question number 7. A Parkinson patient has been effectively treated with levodopa therapy for the last 5 years. Suddenly, he begins to have episodic periods of increased rigidity and marked inability to move. What is the term for the development of this symptom? A. Tardive dyskinesia. B. On-off phenomenon. C. Complex Parkinsonism. D. Chronic Parkinsonism. The correct answer is B. On-off phenomenon. On-off phenomenon develops in Parkinson's disease patients who have usually been on dopaminergic medications for at least 5 years. The on periods are characterized by normal motor function and good medication response, while the off periods are characterized by akinesia, lack of facial expression, gait difficulty, and motor rigidity. Using smaller and more frequent dosing of dopaminergic medications or employing long-acting formulations can help regain control. The etiology of the development of on-off phenomenon is not known, but the progressive inability for dopaminergic neurons to store dopamine is one theory for its presentation. Question number 8. A 17-year-old female has an obvious skull fracture, is tachycardic, and the right pupil is dilated. Select the contraindicated intervention. A. Ketamine intravenously for pain control. B. Sedation with pentobarbital. C. Mannitol for reduction of intracranial pressure. D. Phenytoin intravenously for seizure prophylaxis. The correct answer is A. The contraindicated intervention is ketamine intravenously for pain control. Ketamine may raise intracranial pressure and should not be used for this patient. This has been a long-believed effect, but recent studies have brought this into question. Pentobarbital can be used to sedate the patient. Hyperventilation can reduce intracranial pressure but is usually avoided as it can increase cerebral ischemia. PCO2 should not be reduced below 30 mm of mercury. Osmotic diuretics and anticonvulsants are appropriate acutely. Question number 9. A 55-year-old male presents with ascites, splenomegaly, esophageal varices, and asterixis. He develops mental status changes. What is the most likely etiology? A. CNS infection. B. Impaired hepatic detoxification. C. Acidosis secondary to renal pathology. D. Vitamin B12 deficiency. The correct answer is B. Impaired hepatic detoxification. The patient has signs of hepatic failure that can lead to accumulation of toxins. Hepatic encephalopathy occurs with portal hypertension secondary to chronic liver disease as toxins bypass the liver and accumulate. Hepatic encephalopathy is a nervous system disorder brought on by severe liver disease. When the liver doesn't work properly, toxins build up in the blood. These toxins can travel to the brain and affect brain function. People with hepatic encephalopathy may seem confused. The exact toxins are not confirmed, but serum ammonia is a measurable component. B12 deficiency and CNS infection can cause mental status changes will not present with findings of hepatic disease. Question number 10. Drug metabolism generally results in which one of the following? A. More basic compounds. B. More acidic compounds. C. More polar compounds. D. None of the above. The correct answer is C. More polar compounds. Drug metabolites are usually more polar than the parent compound. Metabolites have a greater degree of ionization, are not as tightly protein-bound, and they are less likely to cross biological membranes than the parent compound. Metabolism generally inactivates a drug and changes it to a form so that it can be easily excreted. Metabolism may also activate an inactive substance, transforming it into an active metabolite. You have just completed NCLEX Reviewer number 13, which featured questions on pharmacological and parenteral therapies. If you wish to watch more NCLEX reviewers on pharmacological and parenteral therapies, check out our NCLEX Pharmacological and Parenteral Therapies Reviewers playlist. Check out also our other NCLEX playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful, and feel free to share it to anyone who may also benefit from it. We wish you all the best on your forthcoming NCLEX, and we look forward to your fulfilling career as a professional licensed PN or RN. Good luck and God bless.